You deal with risks every day at work. Think about times when you're mopping up a spill, checking a medicine dose, or when you see a wobbly patient about to fall. You see a possible problem that could hurt a patient, and you take action. You can use this same process of recognizing risk when it comes to infection control in healthcare. If you learn to spot the opportunities for germs to spread, then you can step in and take action to stop the spread of germs. So why are we so focused on germs in healthcare? The risk for germs to spread is different than it is at home and in the community. There's a higher chance for germs to spread in healthcare settings than, for example, a grocery store, because it's where patients who are sick come for care, and patients who are already weak or ill are likely to be more vulnerable to infection. Healthcare is also unique because some of the things healthcare workers do as part of giving care can put patients at risk of infection, like starting an IV. Sometimes we are the opportunities for germs to spread. We interact with a lot of people throughout the day. We touch a lot of things, and we use many different kinds of equipment. And these are all ways we can spread germs. All of this is why we have to think about infection control in healthcare differently than we think about infection control in the community. So, how can you learn to spot infection risks throughout your workday? There are 5 things that contribute to a germ spreading and making someone sick. Acting on one or more of them can work to stop a germ in its tracks and prevent infections. First, germs need somewhere to grow. We call these places reservoirs, which are simply places where germs live, a habitat, if you will. Our bodies have many reservoirs for germs. 4 of the most important for infection control are the skin, the gut, the lungs and airway, and the blood. The environment around us has reservoirs too: water and wet surfaces, dry surfaces like countertops, dirt and dust, and devices and equipment. Recognizing where germs live is the first step in understanding how to stop their spread. Because when you know where germs might be, you can stop the risk and take action. For example, cleaning and disinfecting high-touch surfaces, which are reservoirs for germs, kills the germs before they can spread. Second, germs need a pathway. They typically can't travel on their own, at least not very far, so they get from place to place when they are breathed in, by touch, or through splashes and sprays. Many of the things we do in healthcare also create new pathways for germs by breaking down or going around the body's normal defenses. Think back to our IV example. Giving a patient an IV breaks their skin and creates a pathway for germs on their skin or in the needle to get into their body. But disinfecting the patient's skin beforehand and using a sterile needle helps ensure germs don't spread to the patient. Third, germs need a person to infect. That person can be a patient, you or one of your colleagues, or anyone that enters a healthcare facility. Infection control actions like telemedicine, screening, and phone triage work because they simply prevent people from being exposed to germs. The fourth factor of infection: when germs get to that person, they need to get around the body's natural defenses. People with healthy immune systems can often fight back. But for someone vulnerable to infection, like our patients who are already sick and struggling to regain their health, germs are an even bigger threat. And finally, the germ has to survive in the environment while it spreads to be able to make someone sick. Note that these 5 factors don't have to happen in this order for a germ to spread. It's very important to perform infection control actions at any point to help prevent infections. So, now that you know what's needed for a germ to cause an infection, when you're about to take on a task, ask yourself, what infection risks might emerge with this task? And what plans can I make to reduce those risks? This can help you recognize when you're in a situation where germs are likely to spread, so you can do something about it to protect your patients, yourself, and your coworkers. Recognize the risks. Protect your patients.